All right, so moving to the next aspect of history taking in obstetrics and gynecology, we'll be looking at another consideration. That's something that you should actually focus on, all right, in the history taking in obstetrics and gynecology. So for this one, you are looking at the medical and the surgical history of the patient. Okay, medical and surgical history of the patient. So for medical and surgical history of the patient, you are looking at why should you actually consider this, and what are the things you should actually focus. Okay, in trying to access the medical and surgical history. So for this one, what you have is taking a detailed medical and surgical history is a very important part, okay, of you in the overall trying to access obstetrics and gynecology history. So it helps to identify if this person has some underlying conditions which may have affected their reproductive health, okay, how their pregnancies will become, or if you do a surgery to them now, if any effects will come up. So medical history in obstetrics and gynecology, for medical, what are the things you are trying to look at? You are trying to dictate if this person has chronic illnesses that may actually complicate their pregnancies, or the chronic illness is now affecting their fertility life. It will now guide safe prescription and drug selection. It will help to access for maternal and fetal complications. Okay, so key areas to explore. You go system by system asking questions. So in the heart, these are I'll just call the system, just pause to read on the areas in which you access, because this is like we are actually studying together. So in the endocrine system, you check it. The respiratory systems, you check it. The kidney systems, you check it. Nervous systems, you check it. Mental health, you check it. Autoimmune conditions, you check it. Blood conditions, you also check it. So in surgical history, why does it actually matter? So you are looking at other surgeries that they might have done that probably would actually have a say in their fertility and pregnancies or delivery options. Okay, so it also helps to anticipate if any complications will come up in new surgeries that you do in this type of patient. Okay, so key areas to explore in surgical history is you try to find out if they have ever done hysterectomy for this patient, myomectomy for this patient, ovarian cystectomy for this patient, laparoscopy for this patient, laparotomy for this patient, if they have ever done any cervical procedures for this patient. So that's for gynecological surgeries. For obstetric surgeries, you are looking at things like cesarean section, dilation and curettage, ectopic pregnancy management, non-gynecological pregnancies, but at least in the abdomen. You look out for things like, have they ever done appendectomy to the patient, because complications, bowel surgeries. Okay, so integration with clinical decision making. So a woman with type 1 diabetes may need higher glucose control and fetal monitoring. Okay, a history of multiple cesarean section, of course, that patient, if they will deliver again, is still cesarean section. Okay, so prior cervical surgeries may affect cervical competence and risk of preterm labor. Okay, so that's what we have on trying to access the medical and surgical history of a patient, where you are taking history for obstetrics and gynecology.